PN1. The client is admitted from the emergency room with multiple injuries sustained from an auto accident. His doctor prescribes a histamine blocker. The reason for this order is A. to treat general discomfort, B. to correct electrolyte imbalances, C. to prevent stress ulcers, D. to treat nausea. Rationale: histamine blockers are frequently ordered for clients who are hospitalized for prolonged periods and who are in a stressful situation. They are not used to treat discomfort, correct electrolytes, or treat nausea. Answers A, B, and D are incorrect. Therefore, acetaminophen. A patient has recently experienced me within the last 4 hours. Which of the following medications would most likely be administered? A streptokinase, B. Atropine, C. Streptominase, D. Coumadin. Rationale: streptokinase is a clot-busting drug and the best choice in this situation. A pediatric client with burns to the hands and arms has dressing changes with sulfamylon, mefenide acetate, cream. The nurse is aware that the medication A will cause dark staining of the surrounding skin. B. Produces a cooling sensation when applied. C. Can alter the function of the thyroid. D. Produces a burning sensation when applied. Rationale: the client should receive pain medication 30 minutes before the application of sulfamylon. Answer A is incorrect because it refers to silver nitrate. Answer B is incorrect because it refers to silvadine. Answer C is incorrect because it refers to betadine. B. 6 weeks. Q. A client taking linezolid, isoniazid, asks the nurse how long she must take the medication before her sputum cultures will return to normal. The nurse recognizes that the client should have a negative sputum culture within A. 2 weeks, C. 2 months, D. 3 months. Rationale: the client taking isoniazid should have a negative sputum culture within 3 months. Answers A, B, and C are incorrect because there to be effective has not been sufficient time for the medication. Question. The nurse is caring for a client scheduled for a surgical repair of a saccular abdominal aortic aneurysm. Which assessment is most crucial during the preoperative period? A. Assessment of the client's level of anxiety. B. Evaluation of the client's exercise tolerance. C. Identification of peripheral pulses. D. Assessment of bowel sounds and activity. Rationale: the assessment that is most crucial to the client is the identification of peripheral pulses because the aorta is clamped during surgery. This decreases blood circulation to the kidneys and lower extremities. The nurse must also assess for the return of circulation to the lower extremities. Answer A is of lesser concern, Answer B is not advised at this time, and Answer D is of lesser concern than Answer A. Question. A client who has chosen to breastfeed complains to the nurse that her nipples became very sore while she was breastfeeding her older child. Which measure will help her to avoid soreness of the nipples? A. Feeding the baby during the first 48 hours after delivery. B. Breaking suction by placing a finger between the baby's mouth and the breast when she terminates the feeding. C. Applying warm, moist soaks to the breast several times per day. D. Wearing a support bra. Rationale: to decrease the potential for soreness of the nipples, the client should be taught to break the suction before removing the baby from the breast. Answer A is incorrect because feeding the baby during the first 48 hours after delivery will provide colostrum but will not help the soreness of the nipples. Answers C and D are incorrect because applying warm, moist soaks and wearing a support bra will help with engorgement but will not help the nipples. The client is admitted from the emergency room with multiple injuries.